Hello, Dr. Ramsey. Amin, talking today about a little bit of a different topic. A patient had asked me a question about a situation where they had a runny nose or stuffy nose after having a dental implant. And that's actually not that unusual. I just don't think I've ever written or talked about that at all. So when you have an implant right in the front, the central incisor, the lateral incisor teeth, those forward teeth in the front, they're close to the base of your nose. The distance from the base of the nose to the roots is, I mean, very small. It could be, even 5 millimeters or so before you get to the inside of the nose. We call the nasal fossa. So sometimes after having a dental implant in the front, you can feel stuffy after having that, or feel like a little runny for a few days. It happens almost instantly after the procedure. It's almost always temporary. I've never had one that's ever become permanent at all. Sometimes it's just from the oxygen that was given to you if you've had IV sedation or to have some supplemental oxygen given to you throughout the procedure. It does dry out the nose a bit, but there is a nerve that goes right down center behind your teeth called the nasal palatine nerve, and it can be kind of like irritated a little bit. It almost gets like tickled, and there's nerve endings that come from your nose into your mouth and from your mouth into your nose. And of course, you go through those little tiny branches of nerve endings that make things a little bit altered for a few days. So sometimes people will say, oh, I feel stuffy, or I feel like I have a runny nose, or they feel like they're getting sick after the procedure, where they're actually not. So just taking like Sudafed or just letting it run its course is typically the way to go if you feel like you've been stuffy afterwards. You don't want to blow your nose hard after a procedure, just kind of blot it. But it is something that does not last too long. Keep in mind that the sinus cavities are different than the nasal cavities. They are interconnected, but in the front of the mouth where the nasal cavity is, it's very much separate from the other end. Of course, if you've had an implant that's put in way too deep and into the nose, well, then that can cause problems where the lining, the mucosa of the nose becomes irritated, and maybe the implant has to be removed or the top of it has to be cut off. We try not to engage the nose all the time. Sometimes on patients that don't have a lot of bone, I'll actually do what's called a nasal lift. Lift up the inside of the nose, add bone in between the nasal floor and the top of the implant, just to get a little bit of a taller implant. But most of the time it's not needed, but it's not uncommon to purposely place the implant to just grab the tip of the nose floor, because it actually makes the implant stronger. It's something that's been done for many years. I mean, 20 plus years for sure. I've done it for that long myself. But it is, if you do have a stuffy nose, keep in mind it will go away. Most likely you're on an antibiotic if you've had a really deeply placed implant, but just let it run its course. If you want some Sudafed, Mucinex, Claritin, there's other options, but in general, it's not something to be overly concerned about, and it should just go away on its own. If it's problematic, contact your dentist or leave a question or comment here. But again, I hope it's been helpful for somebody out there who may be worried about this a little bit. All right, take care. Thanks.